Turns out breathing is important. Shocker, I know. Belly breathing or diaphragmatic breathing has been seen in research to be commonly used to control symptoms of multiple healthcare issues, such as general distress, anxiety, high blood pressure, asthma, and is routinely used clinically to treat pain. Today I'm going to go over a couple reasons why belly breathing is so important, and then go over a basic belly breathing series. Your core is like a pop can, each wall being a vital component to the integrity of that can. You lose one component of it, your can collapses. In this analogy, the upper portion, or the top, is your diaphragm, which we'll be talking about today, which needs to move up and down to allow you to belly breathe. The lower is your pelvic floor musculature. The front or anterior aspect is your rectus abdominis. The sides are your obliques, and the back is your back musculature of your lumbar erectors, your quadratus lumborum, your lats, etc. We want to belly breathe, and when we don't, we tend to breathe into our upper chests. We breathe shallow, and we use our accessory breathing musculature of our sternocleidomastoid, our scalenes. We also tend to see a shrug as a result. We don't use this because we slouch, because we sit a lot, and our diaphragms can't move as well. If you watch a child or an infant breathe, guaranteed they're breathing with their belly because the chair hasn't really screwed them up yet. So trying to allow for that belly breath in your day-to-day can go a long ways. I'm going to go through a small little series of 10 breaths to help to expand that, relax the upper shoulders, and focus on that belly. I tend to start all my patients on their backs when teaching belly breathing. Basically, I am trying to get the patient to do approximately 10 breaths only in their belly, slow and controlled. Typically taught as in through the nose, out through the mouth. So with this, I like to have my patient to start with one hand on the top of the belly. You're going to take a breath in, try to expand that belly up and out. In and out. The next step, have the hand underneath the back. In this case, I'm trying to expand up and expand down. Pushing slightly into my bottom hand and into the top. Finally, you can also work on expansion laterally. You can have your hands at your sides, and you're taking a breath in, trying to get even more expansion. So just to recap, you're trying to breathe up, down, and out to get the greatest expansion of that, all while allowing that diaphragm to help. From here, try about 10 breaths, slow, in through the nose, out through the mouth, trying to expand all the walls of that breath. And that's the belly breath.